saying.
Okay, now I'm taping, just saying.
Next, what are the important assessments to make? So based on the information that you have, that you've come to, what kind of important assessments do you think you need to make based on the patient and all the information that you've gathered? And then what complications could occur? What could go wrong? There's your nursing interventions, Norma. What nursing interventions will ensure the patient stays safe? Okay? So what am I looking for? What could possibly go wrong? What nursing intervention can I implement that will keep this person safe? And it's a whole exercise on critical thinking. Yes, ma'am?
We do these every week?
Yes.
Do we turn them into something?
Yes.
Or-
Your clinical teacher.
Oh.
I have my students turn them in first thing in the morning before they even go hear pre-conference, or go to pre-conference or hear report. I have them do that because I don't want them out there, working on that instead of taking care of their patient. So the first thing in the morning when you come through, and I know you're there and you're right there on time and you're not late, then you put them in my hand and then you go about your business.
And is that when you're going to go over with us if we didn't understand something?
I will go over that, me personally. I mean, however the other instructors do it, they do it. But what I do is then as I go around and I get you individually on every floor, how's it going? I mean, I love to talk to you individually because a lot of people don't want to say things in front of everybody. And I don't either. And so how's it going for you? How do you feel? Well, I had problems with this. I went home, I couldn't figure it out. And then we talk. So we talk, right? I mean, after all, I was born in Staten Island, but you could never tell, right? So, no, we talk, individually. And then if it's really good point that a lot of students may have the same question about, hey, this is stuff we can talk about in post-conference. We really get into a lot of things in post-conference. And we learn from each other because you're going to have patients with all kinds of diagnoses, and you're going to learn from each other. Very important way to learn. Okay?
So you're turning in, I apologize. So you're turning in the care plan from the previous week.
And this work like that you've done, thinking, what you're having to think about, and this is what I'm going to think about today, you're going to turn that in. Actually, if you're in my clinical, you're going to turn everything that's due in the morning. Okay? And it also gives me time to read it while you're hearing report, because you're just on the floor hearing report, and I can read through these things, and sometimes I can even identify the problems that you're having without you even being there. Okay. Next. Oh, yeah. Here we go. Here we go. Deep breath. All right. This is where this card comes in. Please, if you don't have it today, no harm, no foul. I forgot to tell you to bring it. This one card that you got at the beginning of the semester is invaluable to you from now on. This is NANDA. Back in 1970 something, some nurses at a facility got in a car to drive 200 miles to go to a conference. They were from Missouri, I'm not sure the story. And they started thinking that physicians are an autonomous profession. And why isn't nursing? And so one of the things was, well, doctors diagnose and they have a whole set of medical diagnoses that they follow. And they said, well, why don't we have nursing diagnosis? Okay? Because for every one medical problem that the physician comes up with, we nurses have to have already in our head identified 4 or 5 things that can happen to this patient that we have to be on the lookout for, that we have to be alert for, that we have to know what's happening. 4 or 5 different things based on one diagnosis. So they came up and they all got together, and I don't know if they got rich or not, but they came up with the North Atlantic Nursing Diagnostic Association, correct? Okay. NANDA, that's what you hear it called. We want a NANDA. you're going to hear that word. I need a NANDA. All right? The NANDA is a nursing diagnosis. For those of you who have the card, and if you forgot it, share. Is there any bunch of people that doesn't have one? Well, can you share with somebody? Or is there a whole bunch of you that doesn't have one? Because there's an extra one. Well, come get it. Come ahead. Well, you can be on film.
I didn't brush my hair.
You got your cap on, honey. The hair's fine. They can't see it.
Thank you.
Okay. All right. Here is the NANDA. Activity rest. Activity intolerance. Activity intolerance risk score. Activity planning ineffective. You following me? Okay. Now where it says activity and rest, make a little mark on your part. Because you can use those. All right. Circulation, you see that? It says autonomic dysreflexia, cardiac output decrease, gastrointestinal perfusion. Don't put a mark there. You can't use those. Those are med-surg. All right? If you attempt to start using things that you haven't heard in lecture, you'll go way off. Okay? It'll make you cuckoo. Go with the ones that you understand and that you can label and identify. Ego integrity, wait for psych. All right? Elimination, you can mark that. Because in Module 7 and 9, which is coming up sometime in October, we'll be talking about elimination with you guys. So you can mark that one, you can use that. Food, fluid, you can use that. Because Professor Nelson has a wonderful module on nutrition that you'll be having. Where it says neurosensory, don't mark that. Pain and discomfort, you can mark that. Because you're going to be hearing about that concept in Block 1. Some of the respiratory. Professor Gray, have you done that one yet?
No, that's not till October.
Some of her lecture will begin you understanding, you will begin to understand parts of the respiratory. Going back to Brenda and her alteration in gas exchange, you're not there yet, and that even with Professor Gray, you're not going to hear that part because that gets more complicated into acute care with arterial blood gases and all kinds of stuff.
What about hygiene?
Hygiene, yeah, I haven't got that part yet. We stopped at respiration. Is it? I skipped it? Yes, hygiene. Thank you very much. Mark that one, yes. Did y'all learn how to make beds and get baths? Okay, good. You can use that one. Part of the respiratory. If you understand what this NANDA means, go ahead and use it. Safety you can use. That was Module 3. Sexuality, ego integrity, leave that for psych. You can do some social interaction, coping and effective, and you can use the teaching and learnings. All right. So those are NANDA. Now this is what you need to write down in this paper. NANDA, to write a NANDA, by the way, you're going to be doing one of these every single week. So, what you're going to write under the first part of this is the actual NANDA that you're using word for word. You can't change it. You can't alter it. It has to be written exactly as you see it on the card. Step 1. Step 2 is the one that some students find a little tricky. The RT stands for related to. And under this part, I want you to write in big bold letters, no medical diagnosis. You absolutely cannot use a medical diagnosis here. You have to describe what's happening in the body, but you cannot use a medical diagnosis. This is a nursing diagnosis plan. Got it? And then finally, as evidenced by, or the signs and symptoms. So what are the signs and symptoms to lead you to that problem? So I'm going to give you an example. This is what I really needed the time for today. I'm going to give you an example. I scribbled some down for the back page. Mobility impaired. Okay? Now let's just pretend for a minute that your patient has rheumatoid arthritis. All right? And so they have impaired mobility. Would you go along with that with me? So you want to say, okay, rheumatoid arthritis, this guy ain't getting around really good because of the RA. So I'm going to use the NANDA mobility, comma, impaired. Do you see how I said it exactly as it's written on NANDA? That's the first part. Now, related to, I cannot say it's related to rheumatoid arthritis because that, ladies and gentlemen, is a medical diagnosis. I can't write that. But I can say related to inflammation of the joints. Would you concur with that? Yes? So, I look at what RA is. I know in my head why rheumatoid arthritis is causing this person not to be able to move really good. And it's because the inflammation of the joints. So that's what I use, related to. As evidenced by the third part of the NANDA is what I'm seeing. The patient cannot ambulate greater than 5 feet. The patient says, and now this has to be in direct quotes, I hurt when I move. I don't want to move. My elbows hurt. My knees hurt. But when they say that and you're using it, you need to use direct quotes. So, what this is saying is evidenced by can be both objective and subjective, and there are certainly more than one thing you can put there. As evidenced by means, what in it did you evidence that they have this problem with mobility? What is it? Is it something they said? Is it something you observed? And it's usually a combination of both. So all of that is what you write in that third part. On NANDA, ladies and gentlemen, has to be 3 parts. The NANDA related to as evidenced by. Now let's look over at the next column, and the next column is the goal. Do we want them, if we as nurses have identified, okay, let's think a minute about RA for a second. RA, we already talked about mobility. What do you think about their eating? They might not be eating so well? Would you agree with that? And maybe if you've known somebody with rheumatoid arthritis, you can relate to the fact that they're taking a lot of steroids and their appetite is either too much or too little. Do they have pain? Look at all of these nursing diagnoses we're pulling out from one medical diagnosis. Are you following me? So that's why you can take one patient with just the diagnosis of rheumatoid arthritis that the doctor has written, and we go, yeah, well, if it's RA, we're pulling out 5 or 6 different problems, right? That's what a nursing diagnosis is. It's identifying those 5 problems that we as nurses deal with. The physician's going to deal with RA. The physician's going to write the test orders, going to write the medicine for you, going to write the physical therapy that they might need. That's their purview. Ours is other things. You telling me this guy's got RA or this one's got RA? I've got to worry, are they eating? I've got to worry about steroid toxicity. I have to worry about their mobility and all the problems that come with being immobile, right? I've got to worry about their pain. So you see how we can have one medical diagnosis and we as nurses have to address so much more. And that's what a NANDA is. So for this one diagnosis, for medical diagnosis, I could sit and admit this woman with RA, and I could write 5 separate care plans on this one person. Mobility, pain, decreasing immune system because of the steroids or having to take all of these things, their nutrition. So I could come up with 5 or 6 different things that I as a nurse have to address as a nursing diagnosis. Is it making sense?
Yeah.
Okay. Now, but you're only going to address one problem per care plan. Don't start mixing them up. Now, we started with mobility for this, right? So we identified mobility. We talked about the related to being the inflammation of the joints, the evidence by how I knew that they were not being able to move well. Now I'm going to the goal. And the goal is to get rid of the problem. That is